Warm welcome to DPU Skills and Simulation Lab. Today we are going to see and practice the emergency of respiratory arrest. Okay, so respiratory arrest is a common condition occurring in children. That is a very common cause of cardiac arrest in children. So how to give breaths is the thing which you are going to learn here. Okay, before giving the breath, first is your assessment. You see whether the child is breathing or not. Normal respiratory rates you must know. Infant's respiratory rate normally is less than 1 year is? Yes, please? 40 to 50, right? Then school going? About 30. And then after that we come to adolescent and adult. Okay. Now the new ATLS, BLS, ACLS guidelines are saying that for infants resuscitation, the respiratory rate should be 30 breaths per minute. So 1 breath every 2 seconds. The latest guidelines are saying. Okay. For adults, it is 10 breaths in a minute. So how to give 10 breaths? Because in hurry, what you do is you try to give more breaths. So there is a way to monitor your seconds, because 1 breath every 6 seconds. So you have to count 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000 breath. So this is how you are going to see. So before you give the breath, you must open the airway. So you open the airway by either jaw thrust. So this is the way to do jaw thrust. This is the preferred maneuver in case of trauma, because there is least amount of cervical spine movement. And this is head tilt, chin lift. So by doing head tilt and chin lift, the commonest cause of airway obstruction is a tongue which is falling back and blocking the airway. So that tongue is taken care. The tongue comes anteriorly because tongue is attached to mentum. This is the mentum. So you elevate the mentum at the bony part, right? After the airway is open, in hospital scenarios, you use the ambu bag. It gives room air which contains 21% of oxygen, which is good enough for survival. So you hold the mask in this manner. This is called as EC technique. So this is my C, this is the E. So with the C, I'm going to prevent leakage of the air from the mask, and with the help of C, I'm going to keep the airway open. Okay, by jaw thrust. So this is EC clamp technique. Now with this, the other hand is used to inflate. So this is, you can see the breath. So I am counting 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000 breath. At the time of breath you have to give. So that this becomes correct respiratory rate for adults, that is 10 breaths per minute. So I want every and each one of you to do this, because unless you do it, in clinical practice, you are not going to achieve success. So what you have to look for is the visible chest rise. So here we are in the mannequin kept lungs. So by seeing the lungs inflated, you can make sure that yes, your ventilation is successful. So this achieves your 1-person ventilation or single rescuer ventilation. Sometimes you are unable to get a good chest rise, in which case if you have an assistant, you can go for 2-person maneuver. So Alok will help me in this. Look what I am going to do. I am holding the mask with both the hands and making a good seal with both the hands. So this is how I have done the opened airway. With 2 hands I am holding the mask. Now he will ventilate for me. So ventilate, given 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000 breath. 1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000 breath. You understood? So I want each one of you to practice. So first,
this is the C to prevent any leakage, and this is the E for jaw thrust.
Very good.
1 1000, 2 1000, 3 1000, 4 1000, 5 1000, 6 1000.
Very good. 1 1000.
2 1000, 3 1000, 4 1000, 5 1000, 6 1000 breath.
Excellent. So we are getting a good chest rise. So successful.
Yes, sir.
Next person.
So we have created a scene here. I'm making a C, and the C, and with the jaw thrust. First, I'll give the breath.
Yes.
1,000, 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000,
Excellent. Very good.
1 1,000, 2
Everybody can see the lungs are inflating.
4 1,000, 5 1,000, 6 1,000 breath.
Very good. Welcome to DPU Skills and Simulation Lab. Let's get started. So this is a session on automated external defibrillator, commonly called as public access defibrillation PAD programs in European countries. You all know that this is the most essential part of the treatment of cardiac arrest. The commonest cause of cardiac arrest is acute myocardial infarction or heart attack in lay language. So what happens in cardiac arrest or myocardial infarction is there is sudden blockage of blood supply to the heart, and then the rhythm of the heart changes. Normally it is like this, systole, diastole, like this going on. When it is ventricular fibrillation, stoppage of the heart, it is like this. This is called as ventricular fibrillation. So instead of synchronous contractions which are occurring, there is individual fiber which is contracting and relaxing in a haywire manner. So there is no further output, and so there is no blood supply to the vital organs. So what defibrillator is doing, or automated external defibrillator is doing, is it is giving an electric shock to the heart so that all the electrical activity in the heart muscles is abolished, and if the heart muscles are viable, the heart starts to work again, which is the intrinsic function of the heart. So this is how it works. So this is the AED which is available in most of the public places. The AED arrives. The step one is you put the power button on like any electronic gadget. Then we get 2 electrodes. So one electrode goes in the right infraclavicular fossa or below the right clavicle. The other one goes in the apex of the heart, so you can put in the axillary line anywhere. Make sure that the both electrodes are not touching. One is the functioning electrode, the other one is neutral electrode. Then whatever chest compressions are going on, you stop temporarily and allow the machine to analyze the rhythm. It has got microprocessors inbuilt into it, so it will analyze whether it is shockable or not. And if the rhythm is shockable, the machine will talk to you. That is, the auditory prompt is given by the AED that rhythm is shockable, shock advised. If the machine speaks like this, that the rhythm is shockable, then you have to just press the shock button. But whoever is pressing the shock button, you have to make sure that he is not touching the person, victim, and anybody else, nobody else is touching. So he has to say, I am clear. Is everybody clear? So after making a visual check on nobody touching the victim, you have to press the shock button, right? So it will get charged and the shock will be delivered. Once the shock is delivered, there will be a tetanic contraction or contractile movement of the person's victim's body, and then you have to immediately resume the chest compressions. So these are the steps of automated external defibrillator. After that, your chest compressions are continued, 30 compressions, 2 breaths, and every 2 minutes you have to check with AED whether the rhythm is shockable or not. So I want one more person to do the steps. So can you?
This is an automated external defibrillator. When a person has an acute myocardial infarction, in layman's term, if I say it's a heart attack, what I'll do is I'll ask for this.
It has come now. It has come. Your person is here.
The step one is I'll turn on the power button, and then
So power is on. Very good.
and then I'll apply the 2 pads, one in the infraclavicular fossa on the right side,
Very
and
good.
one on the apex on the left side.
Very good.
And then I'll ask for the person to stop the compression
For analysis.
for analysis.
So the machine is talking now.
Yeah.
Shock is advised.
If the machine says the shock is advised, I'll ask the people to clear and not touch the patient. I'll see visually the patient is not being touched, and then I'll switch the shock button.
So this is the shock button. So it will get charged and patient will get a shock. Immediately after the shock is given,
I'll start compressions.
excellent. She will resume the compressions. Somebody?
This is an Aed machine.
So AED has come, the chest compressions are going on. You came up with the AED.
First, the electrodes are put
Power on.
Then electrodes are put on right infraclavicular region and on apex.
You can see in the drawing it is shown where it is to be fixed.
Okay. Then the compressions are stopped and
Temporarily to.
for analysis.
Excellent.
Machine. Then if the shock is advised,
Machine will talk that shock is advised.
yeah, then shock is given.
Before that you will, I am clear.
I'm clear. Everyone is clear. Then shock is given.
Yeah, you have to press the shock button.
Immediately after the shock, compressions are started.
Very good.
This is ADE, so it consists of the on button,
Power on.
power on, and there's two rod electroped. So there's one pad we keep it at the right supraclavicular, infraclavicular
Fossa.
and this is the apex of the heart.
Excellent.
So for this,
You will stop the chest compressions for analysis.
Chest compression for the analysis, and then make sure that the people are far away from here, and then for that, after that, I have to press.
Now the machine
stop
will
button.
tell. The machine will tell whether it is shockable or non-shockable.
Yeah.
If the machine says it is a shockable rhythm, then you are going to shock.
Press the shock button.
Before you press the shock button,
Yes.
you will make sure that I am clear
Yeah,
and everybody is clear.
Yeah.
So nobody should be touching. Otherwise, you will also get an electric shock because our bodies are conducting. So after making sure that nobody is touching, you will press the
Shock button.
excellent. After that, you will resume the chest compressions. Got it?
Yes.
Very good.
So myself, Dr. Alok Gangude, emergency physician, would like to tell you about the CPR criteria and the CPR which has to be given for the basic life support. So we have 5 important points for CPR, that is cardiac pulmonary resuscitation. The first point is we have to give 100 to 120 compressions per minute. Second is 30 compressions and 2 breaths for a patient. The third point is with a proper chest recoil. The fourth point is with minimal interruptions. And the fifth point is push hard and push fast as possible. So for giving CPR, we have to decide the location of the CPR. So it has to be given in the center of the chest, connecting the nipples in the mid part of the sternum. You have to use your dominant hand, which has to be down, and the other hand should be interlocking, right? So what you have to do is you have to keep this part of your palm on the center of the sternum or the mid part of the sternum. Your elbows shouldn't be interlocking, it should be straight, and you have to be parallel to the patient and give proper pressure, and the depth of the CPR should be 5 centimeters and up to 2 inches. So I have to give 30 compressions accompanied by 2 breaths. So it has to be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29 and 30. So after giving 30 compressions, I have to accompany it by 2 breaths, which has to be given by a head tilt, chin lift and with mouth-to-mouth respirations.